Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. If you have not yet subscribed, as always, I would appreciate your subscription to the channel. Not only it helps everybody else find my content, but it helps YouTube algorithm to pick up the content and like pollination to distribute it. So I really would appreciate your support. And if you have been doing it all along, I am deeply, deeply grateful. For all of you beautiful trans femmes, trans women, this video today will be discussing uh, three things, three things that you can do if you don't see desired changes on feminizing hormones. I know that expectations on feminizing hormones and what one can and cannot get is huge. I know that a lot of people put a lot of stock into HRT results. In my opinion, some of you put way too much stock. I did a video about the problem with overemphasizing surgical transition. In this case, I feel sometimes people overemphasize what hormones can and cannot do. And I see all of these things end up, sadly, being detrimental to you on your path to your authentic self. Detrimental in a way where it starts to heavily weigh on you when you don't see the results you want to get. When you start feminizing hormones, of course, it is natural that you may daydream about certain results. You may daydream about your face feminizing, where you suddenly see that innate inner feminine that you envision, the image you may already have of yourself as a woman comes through. You may also daydream about changes such as experiencing breast growth and redistribution of body fat. So your body physique changes to be more curvy and therefore come across as more feminine. Some of you may even daydream about reduction in being able to get and maintain sexual erections. Again, everybody's different. Everybody daydreams about results differently. Some of you are oversaturated with, sadly, a lot of myths out there on the internet about what hormones can and cannot do. There are a lot of people who put a lot of pictures of themselves out there that is photoshopped and through the filters. You don't really see the full scope. As I always say, there's seldom anybody talking about the mid-transition period, the most challenging period. Everybody just suddenly says, did this me and did this after? Oh, wow, look at this amazing transformation that took place. And they don't really discuss that a lot of other things went into the transformation other than just hormones. Regardless of all of this, without a doubt, for a lot of you, hormones are going to be, especially if you decided to step into hormones, it is going to be a big part of your transition. As a psychologist, I know firsthand how instrumental and important feminizing hormones are in quieting down gender dysphoria, quieting down that noise of anxiety, decreasing depression in individuals where it is a byproduct of gender dysphoria, also decreasing anxiety if it is byproduct of gender dysphoria, making people feel more in control, more uplifted, more affirmed. There's without a doubt numerous psychological benefits to starting feminizing hormones, and I have firsthand have seen it with people who do struggle with gender dysphoria. And apart from psychological, as I said, there's all these physical changes you're going to want. So what happens when you get to this point in your transition where you perhaps been on hormones for a year, 2 years, 3 years, maybe longer, and you just feel like you're not getting changes you want. You just feel like what you have gotten so far, even by contrast to everything else, seems to be very, very minimal. Is there anything you can do about it? Well, yes, there is. One of them is going to be medical intervention you can do about it, and two are psychological. So let's start with the first thing you can do about it, which is psychological. The first thing you can do about it is first and foremost acknowledge that hormones work and affect everybody different. You have your own female, feminine blueprint that is going to externalize herself through not only use of hormones, but maybe even if you step into any other gender affirming care. And your body has its own way of responding to hormones. Your body has its own way to metabolize hormones. Your body has its own way of expediting or taking a slower time with producing changes on feminizing hormones. The way your body works is something that is just there. You cannot just change or modify the way you genetically are. So the first thing, which is really important, is to acknowledge and accept the reality of the fact that you have your own genetic composition. And as a result of your genetic composition, you're going to respond to hormones in your own particular way. No two people are going to have exact the same results, taking exact the same type and exact the same amount of hormone. Doesn't work like that. And so it's really important first to acknowledge this reality, because again, it's so easy to fall into traps that, hey, I've seen this and this and this work for this and this and this person online. And I'm hoping that it's going to work for me exactly the same way, and then it doesn't. And then you feel like your body is failing you. You feel like there's something wrong with you. You feel like you're broken. And when you start feeling like your body is failing you, and as if there's something broken with you, you then start to feel hopeless and helpless. And you start getting into your own self-critical narratives that this is never going to happen to me. Why even bother? Forget this. This was a stupid idea, and you give up. Instead of, I encourage you to acknowledge that you have your own way of unfolding your femininity, right? You have your own feminine signature that is going to be different. And no matter how frustrating it is for you to accept that it doesn't happen as quickly as it did happen for, Megan over here on Instagram and Shelly over here on Facebook, you have to, those are some funny names, you have to recognize for yourselves that you're you and you're different. And it starts with that foundational acknowledgement of accepting yourself as your own unique blueprint. And if you don't, you're constantly chasing Megan's or Shelley's physical changes, but they're not yours. They're not yours, they're theirs. So the first is to acknowledge that you have your own unique way that your body responds to hormones, not good or bad, it just is, okay? It just is. The second thing, this is where medical intervention comes in, is to talk to your medical provider who provides you medical hormones. To be very clear about your goals and your expectations. To discuss what are some of the potentialities why your body responds in this way. What can be done? This is, a lot of people say anecdotal because they haven't really published research on this. And yet a lot of times when enough self-reporting collects, it's no longer anecdotal. Not to mention, I witnessed it over 20 years. For a lot of people I work with, let me just talk about my experience. For a lot of people I work with, modifying the route of administration for a lot of trans women, for some reason, tends to almost like push that restart button again. And suddenly the changes start popping up. Don't ask me why. I'm not a medical researcher, but I firsthand witnessed it so many times. Does it happen for everybody? No. But I've seen a lot of trans women I worked with who switched from oral to injections, for example, where suddenly it's almost like, because of the different ways the hormone enters your body, and your body then starts to maybe even metabolize or break it down differently. And as a result of it, different changes pop up. So this is one of the things, is just to talk to a medical doctor. What are the other route of administrations available to you based on your health, right? Because remember, for some people with certain risks, there's a reason why they're put on patches and not on injections, because maybe they're at higher risk for something else, blood clots, for example. So discuss all of this with your doctor and have that open discussion about your goals. So this is one of the medical things, is that go to your doctor, be very clear about your goals, and see what they can do about it. You can do, if they get tweak, get a little bit creative. Finding the right hormone regimen too takes a certain amount of medical creativity. Because again, this is not one of those things where we're dealing with hormones, right? We're not dealing with something that is very black and white. And this is why some people on a very low dose can have very big changes. Some people on a regular dose can have non-existent changes, because it's more of science mirroring art and finding that combination that works best for you. So have a discussion with your doctor. If your doctor is very lacking knowledge or resistant, see if you can find another doctor. Don't be afraid to switch around. The third thing you can do if you're not getting the changes on feminizing hormone that you want to do is, again, psychological intervention. And this one is the hardest one I've seen for people to cultivate. Are you guessing what it is, by the way? Do any of you know what I'm talking about? It's actually the hardest thing for me to do in my life. It's called patience. Being patient and allowing time to take its course is the hardest thing I've seen for people to do. In your position, totally understandable. A lot of you are putting a lot of stock into physical changes and hormones because you're waiting for the changes to kick in so you can feel confident enough to start presenting physically, and so you can also minimize any potential misgendering or anything that might occur. Completely makes sense. At the same time, patience is just going to be part of the process. I don't know how to stress it enough. Patience is the name of the game. It is. Anybody watching this who've been on hormones for many years will comment below and let you know that for some of you, you know this happened to you. For a lot of you, what happened is that none of the changes, and then year 2, 3 mark, suddenly all of these changes started showing up. Sometimes body just needs time to recognize this is the micronutrient you're on, to recognize that this is here to stay. Maybe it's or something has to do with commitment in some of you, where you struggle to commit, and it's almost like your body doesn't want to change. I'm now just overanalyzing it, of course, but your body doesn't want to change because it can feel the psychological resistance. But then when you just let it go and your body goes, oh, okay, so you're committed, we're doing this. All right, well, here are the changes. I don't know why is it sometimes that people are 2, 3, 4, 5 years and then suddenly they see miraculous changes. But that also happens a lot. So patience, starting to become friends with patience, learning how to cultivate that patience in your life, learning how to embrace waiting period, allowing yourself to be okay with waiting. Remember, you're doing this for yourself. You're not doing it for anybody else. And as hard as it might be during this period to wait, this is still your life. And it's important during this period to focus on other parts of gender transition: psychological integration, emotional well-being, spiritual connection to your feminine, um, cultivating and redefining what womanhood is for you, stepping into your own womanhood. All of those things are going to be essential. But these are the 3 things that you can do in case if you're not getting the effects that you really wanted to get from feminizing hormones. Comment below, let me know if you have done some other things, you have some other tricks up your sleeve that you want to share with everybody else. Comment below. Would love to hear your comments. Also, comment below if by changing route of administration things change for you, or if by being patient and cultivating patience you suddenly saw results as well. Comment below. Love reading all of your comments, and I will see you all next time. Goodbye.